I have say a 9-month-old or a 4-year-old or an 11-year-old and say, oh, we're going to start this systemic biologic, the the patient or family are going to say, and how long do we treat for? It's an obvious question. We're used to what we're used to as dermatologists, but they're going to ask that. And I think that you don't have to come up with what's been the default in adult psoriasis, which is probably forever. And from to be truthful, much of adult atopic dermatitis, whereas it's probably forever. It may not be that we need to do that in pediatric atopic dermatitis. And even if it is that we end up with that because the life impact is so incredible, um, we're still going to offer the possibility that we may not need it. And to be truthful, what we do often is after a year or 2 years, when a patient's clear or almost clear, there are ways sometimes what I standardly do, and it's all off label, is that but most experts will end up decreasing the frequency of the injections, or occasionally even tapering some of the oral jacks in a slow way, sort of testing the need for it. I have many patients who are, for instance, maintained on dupilumab, and they're older adolescents who are on every 5 weeks, okay, or younger kids who are on every 6 weeks, but they may stay on it they decide at 6 weeks if they think the disease is coming back. So but I think it's perfectly reasonable as the next step of our evolution of management is to sort of figure out what families may need, although usually with an extended course of a biologic if they need it, or advanced systemic therapy to make sure you get that life impact of changing the disease significantly.